So I am your host. I'm Melinda Herzog. If you haven't met me, I'm the Healthy Communities Program Leader at Cornell Cooperative Extension of Ulster County. I do coordinate the Healthy Ulster Council in a partnership with the Ulster County Department of Health and Mental Health. And I'll ask our other co-hosts to introduce themselves. Stacy.
Hi there, I'm Stacy Kraft, Public Health Education Coordinator at the Ulster County Department of Health, and I'm happy to see you all in 2022. Thank you for coming.
And I'm just going to skip down to Katie. I'm not sure Joe was co-hosting today. I needed to change that slide. So Katie, you want to introduce yourself?
I'm Katie Sheehan-Lopez. I'm the Regional Farm to School Coordinator at Cornell Cooperative Extension.
All right. So again, letting everyone know the meeting is being recorded. I'd like you all to say hello today by typing your name and organization in the chat. That lets everyone here know that you're here and also helps us sort of take attendance for the meeting. I'm asking everyone to stay muted throughout the presentation, and you will be able to ask questions in the chat, and I will read the questions aloud and make sure that you are heard through the questions that you place in the chat. And then after the presentations, we will have a networking session where everybody's able to unmute, and it'll be a facilitated discussion where we can, you'll have an opportunity to talk and share a little bit about your program. So those are our housekeeping rules for the day. And our meeting agenda today, we've got two presentations, Regional Farm to School and also the Tobacco Dependence Treatment, Improving Health Systems for a Healthier New York. We've got some special guest presenters today to share a little bit about that as our professional development. We'll then have our stretch session, just a little bit of move around as we sit in front of our computers today for 3 or 4 minutes, and then our facilitated networking session. So that's what's on our agenda. We're excited to get rolling. And I am going to introduce Katie Sheehan-Lopez. She is our Regional Farm to School Coordinator at Cornell Cooperative Extension of Ulster County. And she'll be presenting today on the Regional Farm to School program. And I'll stop sharing and let Katie share her screen.
All right, thank you. All right, okay, I think everyone should be able to see that. It's good? Okay.
Yes.
All right, so my name is Katie Sheehan-Lopez. I'm the Regional Farm to School Coordinator. And I'm going to give a quick overview today about Farm to School, talk a little bit about how schools purchase food. I'll talk about the New York State 30% initiative, and then some of the challenges and opportunities and things we're working on. So this is going to be a very, very high level overview. There's lots and lots of details. If you have questions, I'm more than happy to answer, but I don't have time to dive into everything today. So, all right, so Farm to School, if you have an image of it in your head, you can share what you think it looks like in the chat box, but I'm gonna give you just like a quick overview of one of the ways we can frame Farm to School, because it can look very different in different schools. So it really depends on what's going on in different schools and where they're located. So we like to think of it in terms of the 3 C's. This comes from the Farm to School Institute in Vermont, actually. So the first C is cafeteria. And this is bringing local foods into school food service, serving them in the breakfast and lunch program. So that's fairly straightforward. We also have community as one of the C's, and that would be bringing in maybe community organizations that are working on Farm to School, doing some education with parents, maybe educating the staff in the school at large, doing events. You know, there's lots of activities you could do with the community around Farm to School. And then finally, the third C is classroom. And so this is either training teachers or bringing in an outside presenter into the classroom and really educating students at their grade level about farms, nutrition, and the food they're seeing around them. So, you know, most Farm to School programs have, you know, activities going on in one of these categories. maybe in 2 categories. If it's a really, really robust program, it's going to have activities in all 3 categories and be really holistic. But that's not that common because it takes a lot of time to build that, and it really does take a committee in a district. So all of that being said, my role is really focused on the cafeteria part of it. So focusing on procurement. And our goal for the regional farm to school program is to increase the volume and variety of New York State foods in school food service. So that's our definition of local, is something that's grown or has ingredients from New York State. But we work, we'll dabble in the other 2 C's as needed, of course. So this program is actually new to this region, and I just started over the summer. So I'm about 6 months in, still learning a lot, but we have not had farm to school coordinators in the Hudson Valley, although they have existed in other parts of the state. So this is my region. So I'm technically, we call it the Upper Hudson Valley. It's a 6-county region. So you can see all those counties right there. It's quite large, especially when we throw Delaware County in there. That's a really big county. So altogether, there are around 55 school districts in this region. And not all of them are doing farm to school. And I'm not even involved in every district that's doing farm to school, because there are some local coordinators here and there. For example, Sullivan County has a farm to school coordinator in the county. Beacon district used to have its own farm to school coordinator, and then there's some up in Delaware County also. So anyway, it's a fairly big county, but there's lots of opportunity also. I'll also mention that there is a regional farm to school coordinator in the Lower Hudson Valley. So that's Orange, Putnam, and Rockland, and a little bit of Westchester. And we work very closely together, since there's obviously a lot of overlap in distributors and farms. Okay, so I'm going to give a very, very brief overview of how schools purchase food, because this is kind of key to understanding the whole thing. So it's really nice to think like, oh, here's a school and here's, farms, they should just buy from the farms, but it's not nearly that simple. So when schools purchase foods, they have 2 pots of money they can use to purchase food. So the first pot of money would be USDA funds. So you might hear it referred to as like brown bucks funds or entitlement dollars. It's all the same thing. And these are funds, it's not even funds, it's really a line of credit that the government provides to districts, and it's based on participation. So a big district with a lot of participation is going to get more dollars than a very small district. Food service directors can choose to divide up those funds in about 3 different ways. So the first is the commodity foods. Those are the things we probably think of, like cheese, ground beef, frozen vegetables. Those are like the brown box foods that people might mention. So, and that's why you see all those foods on school lunch menus all the time. They can also take those foods and then use some of those funds to pay for processing. So for example, they can purchase chicken and then have it processed into nugget form, or a mozzarella stick, or pizza. These are really common school lunch foods that we see all the time, and the schools do not have to spend any of their actual dollars to get them. There's a third bucket of money that's for fresh produce, and through a participating distributor, of course. So anyway, this is a big pot of money that schools can use to purchase produce, which is great, but it's not necessarily going to be local produce, although sometimes it is. Okay, so they have that money, and then also we have our school food budget. So this is actual dollars in the school that they receive from both paid meals, which we really don't have these days, and also government reimbursement. So working with usually a limited budget. And then they can spend this. Well, one thing they have to spend it on is labor. So this is about half of that, just to pay for staff. So Once that's paid for, then they have to buy all their, cleaning supplies, paper products, and especially now if districts are using disposable trays, this can be thousands and thousands of dollars just on, disposable things because of COVID. And then, of course, they have the food. So that's for everything else. So when we're thinking about, what we can spend, what dollars we have to spend on local food, we're really working with this one, the produce, which, may or may not be local, and what's remaining in the food service budget. Okay. The other important thing to consider when thinking about how schools purchase food is that they are government agencies. And so everything they purchase, not just food, has to be purchased through a bid process. In Ulster County, the 7 of the districts purchase through a formal bid through Ulster BOCES. So this, bid goes out, distributors bid on it. So they're really taking advantage of the lowest price. And it's good because it keeps prices down and then it's our taxpayer money, but it also can be a little bit limiting because they have to work with the vendors that are, that are awarded the bid. And then the cooperative bidding is just, that's how it goes through Ulster BOCES. 7 out of the 9 districts in Ulster County purchase off of a cooperative bid. And the other 2 have food service contract management companies, which is a whole different ballgame. So anyway, that's just something to consider. It also leads to some opportunities. The 30% initiative, so many of us may have heard about this, and it started in 2018. So former Governor Cuomo launched the No Student Goes Hungry initiative that had a couple of different provisions in it, but one was this 30% initiative. So with this, if a district spends 30% or more of its lunch costs on New York State foods, they get a bump in their state reimbursement. So their reimbursement for those lunches goes from 5.5 cents to 25 cents. So it's a pretty big jump in reimbursement. It's an extra 19 cents per meal. And when you think about how many meals per day and how many days per year, it can really add up. So for example, in a district like Kingston, which is serving around 3,000 meals a day, it's something in the ballpark of $100,000 that they would get the following year. And in a smaller district, it might be like $10,000 or $20,000, but that's a new convection oven, as one of the food service directors put it to me. So, it's money and it's a really good motivator for some school districts. But, there's lots of ways to do farm to school, like I said, and this is only one of them. So this is a map of the first 2 years of that program. So I don't have the data for the 3rd year of the New York 30% initiative, and we're currently in the 4th year. But you can see the red and the blue dots are the schools that successfully qualified for the 30%. If you obviously you're probably noticing there is a couple big holes in this map, and one of them is the Hudson Valley. And so that's one of the reasons that, I'm here today, is because when these green dots, if you can see right here in Western New York, those are farm to school coordinators, and all the districts that were successful are clustered around a farm to school coordinator. There's another issue about getting New York State milk into the Hudson Valley, which is also an issue. But those 2 things are being worked on currently. And so we're hoping, probably not this year, but next year, 2022-23, to have several school districts that qualify for the 30% and then get that money so they can use it in their food service budget. Okay, so some of the challenges, there are lots, but I'm just going to quickly touch on a few. So one, currently, this is just specific to now, supply chain, labor shortages. A lot of the food service directors I work with are running the cash register like a couple of days a week because they don't have staff. And so obviously if they're spending time doing that, they're not out, looking for new products and developing new recipes. So that's a big problem. Processing capacity is another one, and it really varies district by district. But if you get a bag of frozen French fries, that's kind of easy to heat up. If you get a 50-pound bag of potatoes with dirt on them from a local farm, someone has to scrub those, peel those, chop those, bake them, and it takes a lot of time. And not every district has the equipment to do it in bulk. So it's an issue. Cost is an issue for certain foods, not always, but it can be. And of course, there's lots of regulations around school food and how they purchase it. So it's just always something that food service directors have to navigate. And availability of local products. So there are certain processed products, which I'll mention in a few minutes, that do qualify as New York State products, but are just not carried by distributors in the Hudson Valley. So that is it's a challenge and an opportunity. Oh, and for the 30% initiative, documentation is quite burdensome. So there's a lot of tracking and paperwork that food service directors have to do. And it is, it's a lot of extra work, but it's something I can also support if food service directors are interested. Okay, so enough challenges. I'm going to talk about some of the opportunities we have and also some of the progress. So this happens to be a very job that gives me a lot of instant gratification, which I really appreciate. So like I've already seen things happening even in the 6 or 7 months I've been doing this. So one opportunity is to work with local distributors. So there are only a handful of big distributors that are working with schools. And if we can get them to carry certain products and just make them available to food service directors, that makes things that much easier for food service directors. They don't have to go out and find them. So that's something we're working on currently. And then we can also write geographic preference into bids. So this is a way to weight New York State products. So it's not only based on price, but there is some preference given to products that are from New York. And the Ulster BOCES purchasing coordinator is open to working with us and willing to help schools get to 30%. So we might have 4 school districts next year that can at least get close. Documentation for New York State milk. Generally all milk is local, but if the paperwork isn't in order, it doesn't count towards the 30%. And the dairy industry is quite convoluted, as I'm learning. And we may be also getting milk from Connecticut or Massachusetts. So, that may be local depending on your definition, but it wouldn't count for that 30%, which is one of the challenges that we've had in the past. So that's all, it's being sorted out as we speak. Training and events, obviously, we've already done a series of trainings for food service directors. We've talked about doing a food show, but then COVID has kind of dampened everyone's enthusiasm for, eating in public. But, things like that are what we're talking about. This is just a stock photo, but we could take food service, staff out to a farm and do trainings like that. We're bringing farmers and connect them with classrooms and farm to school programs. So lots of opportunity there. And then promotional campaigns. So you have to let your families and your teachers and everyone know you're doing all this hard work. So this is a Buffalo poster, but I'll talk about what we're doing here in the Hudson Valley in a minute. Oh, and then new product development. So fingers crossed, we may have processing capacity in the Hudson Valley in the next few years. There's also a food hub in Rochester that is doing frozen local vegetables, and we are trying to get that into the Hudson Valley, even though it's pretty far. And then things like bread. So we have 3 districts in Dutchess County that are, able and willing to kind of spend a little bit of extra money on local bread. And so I connected them with Our Daily Bread, which is based in Chatham, and they're going to be, doing a loaf of bread that schools can use on a monthly basis. So, just kind of as a special promotion. But things like that are opportunities, even if it's not on a huge scale for every single school in the district. These are the districts I've been working with in Ulster County. So you see them all here. Ellenville's a tricky one because they have a contract management company, but Kingston, Ontario, and Rondout Valley we're in talks, everyone's at various stages, but hoping to, get people kind of organized for next year. And these 3 districts also buy off the Ulster BOCES cooperative bid, which is a huge opportunity. Okay, so these are some foods. I'm not going to talk too much about this because I think I'm probably going over. These are some potential New York State foods that we could have here in the Hudson Valley. We just have to get the distributors to carry them. So I won't talk about each and every one, but I will say we often think of farm to school as vegetables or fruit, but any part of the tray could be a New York State item. So this pasta is made in Coxsackie and it's made with New York State grain. And that qualifies as a New York State product. It's, local according to my New York State definition. Produce obviously could fall in here, but there's lots and lots of options and lots of ways to bring in new products. Okay, so this is an example of some of the promotions. So anyone who has a student in the Ontario district, the food service director is really on board with Farm to School. She is also running the cash register very often, but we've been doing a monthly New York Thursday, and New York Thursday is just a campaign that Ag and Markets has coordinated. So this poster, every cafeteria had posters when they did kale salad in December. There's a social media post that went out, and this is a picture of the tray that she said there were apples that day from New York, but this was the picture that she got. So anyway, we have, if we had an apple, we had local milk here, local kale, that's 3 out of 5 main components of that tray that are New York. And so the goal would be to increase it or maybe do it more often. And then, kind of grow the program from there. But that's one example. Hopefully Rondout Valley, we're doing something this spring in Kingston too. And then these are some of the community partners that are doing farm to school work. So there is an Ulster County Farm to School working group that meets every 2 months or so. You can just read down the list there. And then I'll just add that if you have students or are involved in a school in any way, in any of those counties, or even in the southern Hudson Valley, school wellness committees and PTOs are great places to get involved. And I am more than happy to go to a board meeting or a wellness committee meeting or whatever it is and do a short presentation on farm to school and see what the next steps might be. So I will leave it there. And if anyone has any questions, I will put my information in the chat again. And I'll put our the Harvest New York's Farm to School website. So you could, look for more information, or please feel free to reach out to me with any questions.
Thank you, Katie. That's great. Really enjoyed your presentation. I think that it's so very relevant for, our group to understand the issues with incorporating healthy food into schools, of which there are many that are so complicated to understand in all of the purchasing that school districts do and the contracts that they have and some of the requirements that they're under. But we all know that school food plays a really important part in, the diet of many of our children in the county and in the region. And of course, we're trying to fight childhood obesity. So this work is really, really relevant, and just delighted to have Katie share it and present it. I'm going to look through the chat. If you have questions, please do put them in the chat for Katie. I've got a few comments. Vin has said great work, Katie, and Kate as well had said great work, Katie, and Cindy said thank you, very informative. And Katie has put her information in the chat. Kristen Kessler, fantastic, super interesting to hear about your program, goals and challenges. Thanks so much. I I guess I do have a question, and that's as you go through all of the different districts in the 6 counties, how do you choose which districts to work with? Are those chosen for you, or how does that happen?
No, so there's no criteria for which districts qualify to do farm to school and work with me. So it's really right now anyone that's interested. I even, if someone outside of the district that made a little sense, or the region, like Rensselaer School District, they don't have a coordinator. So I'm not going to say no unless I am like just absolutely so busy I can't have time. But right now it would be any district that's interested, but keeping in mind, I am focused on procurement. So if someone wants someone to come into the classroom and teach, that's not something I would do, but I'd be happy to find a person that would and make that connection.
Thank you. So that's very important for everyone here who's interested in having this program come to their district. Do reach out to Katie. We have a couple of more comments. Happy for the improved impact for climate change as well. That came from Stacy Kraft. Susan Lennon said, thanks, Katie. This was interesting and informative. And Ruth Stratton from Fidelis Care said, this was wonderful. Can you tell me what the name of the program that schools can receive the 30%? What's the name of that program?
Yeah, it's called the New York State 30% Initiative. And I will find a link and put it in the chat box.
Awesome. Thank you so very much. Any other questions for Katie? Okay, well, thank you so much for sharing. And again, Katie's information is in the box if you want to reach out to her and have a separate conversation on that. I'm going to bring us back to our PowerPoint that just kind of guides the meeting. If you've noticed, I suddenly have a virtual background. During Katie's presentation, the sun has been attacking me and I've been sliding down the table I'm at, and now I'm in front of a window. So I changed my background so you're not the window glare isn't behind me. I'm delighted to see the sunshine. It's so cold out, but I wasn't anticipating it. So I've got a different look for the moment. I want to introduce today our next guest speaker, and just delighted to have them here. We have Khushbu, I'm going to do it, Khushbu Apodier and also Susan Lennon. They are both from the Center for Tobacco-Free Hudson Valley, the American Lung Association, and they'll be speaking today about tobacco dependence treatment, improving health systems for a healthier New York. And I'm just delighted to have you here to share with us the information on this. It's such a very important program. And I'm going to stop sharing and let you guys have the screen.
Thank you, Melinda. Please let me know if you're able to see my screen.
Yes.
Okay, great. Good afternoon, everyone. First of all, thank you so much for inviting us to speak about our program. Thank you, Melinda, for reaching out to us and giving us this opportunity. My name is Khushbu Apodier. I'm the tobacco specialist for the Center of Tobacco-Free Hudson Valley. I'm joined here today by Susan Lennon, who is my manager, who most of you know. Before going into the details and the topics of my presentation, I would quickly like to introduce to you about our work, what we do, and who we are. We are a part of Health Systems for Tobacco-Free New York. We call our system is called as a Center of Tobacco-Free Hudson Valley, which is a grant program of American Lung Association and funded by the New York State Department of Health, Bureau of Tobacco Control. Now, tobacco control program in New York State was established back in January of 2000, and it is built on foundation with evidence-based practices. Our main mission is to partner with medical and behavioral health organizations so that we can provide them with resources and educations so that they can integrate tobacco dependence into their existing workflow, basically help them with capacity building so that they can offer treatment to their patients and increase the chances of quitting in them. Our focus area is mainly on federally qualified health clinics, which is FQHCs, behavioral health organizations, and community clinics. We are a team of 3, myself, Susan Lennon, and my colleague Ruth Pollock, and we cover 7 counties in Hudson Valley. Now, today, my agenda for presentation would be touching on briefly on these topics, and thanks, Melinda, for suggesting these topics to us, because each topic itself could be a presentation by itself. I'll try to be as short as possible in this and just give you a highlight of some of these important details in this. Now, everything that I'll be talking to you about in regards to treating tobacco use independence comes from the US Public Health Service Guideline, which was established back in 2008. Tobacco still remains the #1 preventable cause of death in the US. As per the data in 2018, approximately 16.1% adults in the US are current smokers. Now, going back in 1960s is when research started showing that smoking is injurious to health. In 1964 is when the Surgeon General released the report which indicated the health impact of smoking on your health. So right from 1964 up until 2022, we know tobacco is harmful for you, but still it is a #1 preventable cause of death in US. And what is more surprising is that 70% of the smokers want to quit, which means that they are aware about the harmful impact. And studies have found that the smoking rates kind of jump from 70 to 30% if a healthcare provider is involved in advising them and assisting them in quitting. Going a little bit into details about the data, how New York State is doing compared to the rest of the country. On the left, you can see the prevalence of current smoking in New York and US. This data is from 2018. As you can see, the prevalence in New York State was 12.8% versus that in whole of US, which was 16.1%. And I would give credit to the New York State strict legislative policies, which have been coming time and again to help us bring these numbers down. On the right, you can see the downward trend in the prevalence of tobacco smoking in New York State, which was 18.1% in 2011, and it's gone down to 12.8% in 2018. Which is almost 34% decrease. So we have done a lot of work, but however, a lot more needs to be done still. Now, while I was preparing this presentation, I thought it would be really interesting to compare how each neighboring county is doing. So here are the quick numbers of how each county is doing as of 2018. We are still waiting for the latest data to come in, but as from this data, you can see, I know each county varies in terms of demographics, but you can see that the numbers of the smoking rate varies from 7% in Westchester and Putnam to almost 21% in Sullivan. And you see Ulster in 13.1%, so which is really good, which is it's midway between the extremes. I would like to highlight that back in 2013, the rates in Ulster was 21.1%. So they have done really well in bringing the numbers down. And once again, I would like to acknowledge the Ulster Department of Health for including tobacco prevention into their chronic disease prevention. Now let's see who exactly is smoking in New York. Like in any kind of health condition, we also see disparities in smoking in New York. As you can see from this chart, this is again data from 2015. So you might see a little bit of a difference in the total adult smoking rate. However, we find similar trends going on even currently. As you can see over here, rates are higher in those with low education level, low household income, and poor mental health. So this kind of justifies the reason why we would like to work with federally qualified health agencies and community health centers, because these are the areas where this population is going to seek help for help. And we would like to equip their providers with the tobacco treatment so that they can offer that to their patients and help us to bring the numbers down. Now, regarding poor mental health, which is again a huge topic, behavioral health and smoking, and we would definitely like to collaborate with behavioral health organizations and help to train their staff with tobacco dependence treatment so that we can bring these numbers down as well. Now, what makes tobacco that addictive? It's the nicotine content in it. Research shows that nicotine reaches our brain in about 7 to 10 seconds, and it causes release of a chemical called dopamine, commonly known as a feel-good chemical, and it causes immediate change in your mood and behavior. Once a person experiences this, he wants it more again and again, and that's how they get addicted to it. And this becomes difficult for them to quit smoking. E-cigarettes, commonly called as e-cigarettes, is another term for electronic nicotine delivery system. Before going into detail of this, I would quickly like to read out to you how FDA defines a tobacco product. Any product made or derived from tobacco that is intended for human consumption, including any component or part which contains nicotine and is likely to be consumed, whether smoked, heated, chewed, absorbed, inhaled, or dissolved. So FDA has included a very wide definition of tobacco product, and e-cigarettes definitely fall into that. E-cigarettes is any kind of device which is used to deliver aerosolized nicotine or any other substance to the person inhaling it. And this would not be limited to just e-cigarettes. It includes vape, Juul, pod system, e-cigar, e-pipe, vape, or e-hookahs. This is how an e-cigarette would look from inside. And it has been a major concern, especially for our younger population, because the whole industry of e-cigarette has made these products so attractive for the younger generation, adding flavoring to it and adding colors that some of them hardly realize that they have been consuming nicotine. What these products consist of is basically, they are not combustible. They are battery operated, and they kind of heat up the liquid from the cartridge, which becomes filled with chemicals, including nicotine, and that's how a person inhales those chemicals. I would like to show you this trend of tobacco use among high school students. Although it is it's very satisfactory to see that the trend is downward, but we still need to do a lot of work, especially over here. If you can see, the rates are very high, especially in terms of electronic nicotine delivery system and any other tobacco product. Flavored tobacco products. Now, this has been a biggest concern for us. Tobacco industry, again, has been adding a lot of flavors, making it much more attractive for the youth. And by flavoring, what happens is that it kind of improves the taste and reduces the harshness of tobacco product, which makes it easier for someone to consume and get addicted to it. On the other hand, New York State has been taking strict precautions. As of May 2020, the sale of vape products, including mint and menthol, has ended in New York State, and pharmacies can no longer sell tobacco products. As of July of 2020, retailers in New York State can no longer accept coupons for tobacco products. So this has been a major step taken by New York State in order to curb this sale of tobacco. Now, harmful effects of tobacco. I know it's a very well-known topic, and most of you might be aware of this, but kind of tells us why we still need to address this issue. One of the biggest harmful effects is cancer. Tobacco smoke contains about 7,000 chemicals, out of which 69 are identified as known carcinogens. And I've listed a list of organs here. Basically, it can cause cancer of almost any part of your body. Apart from cancer, other chronic conditions which are caused by smoking can be heart condition. A person who smokes is 2 times more likely to get a chronic heart disease compared to a non-smoker. Chances of stroke. It can affect your pulmonary system, causing pneumonia, asthma, emphysema, chronic bronchitis, or COPD, or our very old, very new friend, COVID. Smoking can also cause a lot of oral disease and circulatory problems. Conditions which are linked to smoking. Pregnancy outcomes have been impacted by smoking. When a pregnant female increases the chances of low birth weight babies or premature birth if she's been smoking during her pregnancy. Impact of secondhand smoke in children can lead to SIDS. Smoking can impact drug consumption. It can interfere in their actual action. It can impact wound healing. It can cause macular degeneration, leading to blindness. Smoking can also impact the fertility, both in male and female. It can cause burns, car crashes. Just wanted to take a quick second to highlight that secondhand smoke, and recently found out about third-hand smoke exposure, is also very crucial. Children, casino workers are the common population which have been subjected to the effect of secondhand smoke. Third-hand smoke is basically the residual products or chemicals which are left on the carpets or the walls. The common vulnerable population for this are the children. Behavioral health and smoking. This again can be a presentation by itself and almost in 1 hour talk, but I'll try to restrict myself to just 2 slides here. Approximately 41% of patients with behavioral health are known to smoke. And it's a known fact that people with behavioral health tend to die quicker compared to the general population. There's a 25-year mortality gap. And 44% of the cigarettes consumed by the individuals with addiction have comorbidities like substance abuse or a coexisting mental health condition. The reason I'm stressing more about behavioral health is because oftentimes tobacco treatment takes a back seat in any kind of behavioral health setting because they need to address any other substance use. However, we would like to highlight that your patients might be out of one addiction and might be out of your treatment center, but 10 years down the line, they might die of cancer because they have been taking tobacco or smoking any form of cigarette. So it's really crucial that you have an opportunity to address tobacco use along with substance use. Again, smoking causes more deaths in alcoholics than alcohol, and people who are alcohol dependent are 3 times more likely to use tobacco. The moral of this whole conversation about behavioral health is it is very important that you address tobacco treatment along with other substance use treatment because it increases the long-term abstinence, because you do not want your patients to undergo the same withdrawal symptoms for tobacco dependence as they undergo with any kind of substance abuse. Talking about the 5 A's, this is coming from the clinical guideline for treating tobacco use. This is considered a gold standard of treatment for tobacco use and dependence. Asking every patient during their visit about tobacco use and not just restricting yourself by asking, do you smoke? We need to ask further. Do you consume any kind of vaping products? Because most frequently, some of the younger population aren't even aware that their vaping products also contains tobacco. Advise them to quit smoking. Assess their willingness to quit. Are they ready? Are they ready to take the next step, or would they like to take some time? And if they express this, yes, they are ready, assist them with quitting. This can be in form of offering counseling sessions, offering FDA-approved medications, or offering nicotine replacement therapy. If a person refuses for readiness to quit, then make sure that you're following up with the same question next time so that there's an opportunity even the next time advising them to quit smoking. I would like to highlight the work of one of our partners here, New York State Smokers Quit Line, which is available to all New York State residents for free. It offers cessation services in form of coaching, in form of nicotine replacement therapy. We often ask our partners, the healthcare providers, to refer their patients to Quitline. Quitline offers nicotine replacement therapy in form of lozenges, patches, gum. They do offer coaching. They have trained staff who can conduct these coaching sessions. They can even refer the patients to other cessation services in their local areas. This kind of gives us a good overview about the percentage of smokers who were asked, advised, and assisted during the provider visit. As you can see over here, the trend from 2014 up until 2019, we can see that the ask component of the 5 A's has remained fairly constant. We are seeing an upward trend with advice component, advising patients to quit. Assist component has also gone up from 45% to 55.5%. What we would like to see is that the assist component goes up, and this is the reason we are here to help out the healthcare organization to develop that policy so their staff are equipped to assist their patients with cessation treatment. Once again, I would like to stress that clinician involvement is very crucial. This data shows, compared to smokers who received no assistance from clinician versus smokers who had received assistance, it increases the likelihood of abstinence by 1.7 to 2.2 times compared to non-smokers. Last but not the least, smoking and COVID. How are these two interrelated? And I was very impressed when I went through this WHO website, which kind of mentioned that the whole act of consuming a tobacco product, a patient is going to use their hand, bring it to the lips, which increases the chances of contacting the virus. Smoking is often a social activity, getting together, exchanging devices, exchanging hookahs and pipe kind of increases the chances of getting COVID. The pathophysiological changes which smoking does to your body, especially your lungs, increases the chances of getting COVID and getting intense or severe symptoms of COVID. Again, just as in smoking that we have seen disparities, same disparities are starting to observe in COVID patients as well. So definitely smoking is injurious and it kind of increases the likelihood of getting COVID and increases the severity of symptoms. The organizations which we partner with in Ulster County, first of all, the health department, I would really appreciate, I'm really thankful for including tobacco prevention in one of their community health improvement plans. Some of the partners with whom we partner in Ulster County are Getaway Industries, MHA, Institute of Family Health, and Ellenville Regional Hospital. We can definitely increase the list, so definitely reach out to us and we are here to help you with any kind of assistance with tobacco treatment. Thank you so much, and I'm happy to take any questions.
Thank you so much, Khushbu, and thank you, Susan, for being here today and sharing this really important information. I'm going to encourage everyone again to put some questions in the chat. I know that Vin had asked if the presentation would be made available, and with your permission, we'll post that. We can also share that. Vin has made a couple of comments that you may have seen pop up, that 4 out of 5 of the leading causes of death in the Ulster County are tobacco related, tobacco use related. And the 5th, of course, is opioid use. Susan also added that tobacco use also exacerbates drug use and can impede long-term recovery. I'm going to encourage everyone here to put your questions in the chat. I actually did have a question, and I guess it was sort of related to your slide on COVID. And that's very much, we hear that people that are more impacted by COVID due to comorbidities have been seeking more assistance. Have you noticed that with tobacco treatment? And I know that you're sort of back in the saddle again, but is that data that's available to you?
We still don't have that data available to us, but ALA has done some work which kind of helped me to find out more that how smoking can cause changes in your respiratory symptoms, which can intensify COVID. However, this is being very recent, so we are still waiting for some data on this, and Susan can even reply on this as well.
Similar to what you're saying, Khushbu, yes, in the very beginning of the pandemic, if you recall, there was one of the comorbidities was smoking. They said that smokers were more impacted, people who were obese. They had a couple of different target areas that we were hearing about. And then over time, we haven't heard much about smoking in a long time. So I'm talking anecdotally. As Khushbu said, I think the long-term studies will show that people whose immune systems were compromised because their lungs were damaged from years of smoking will certainly show that that there's a correlation between impact, at least in the early days. I know some of our partners who are associated with large healthcare organizations and hospitals are doing internal studies, because when they had people coming into the hospital and they did their history, they were making connections between those who were being admitted and their outcomes versus and who were smokers. But the truth of the matter is we don't have any firm data to share with you on that. So I think that more will be learned in the future. But it's a good question.
Thank you. Yeah, I was just curious if more people were seeking assistance, but you've kind of answered that question in that that information isn't really hitting the public eye that it could be an issue, especially with the data backing it up. So that may be something that comes forth. Ninette Warner just shared that she read an article in the New York Times yesterday that said cigarette sales increased last year, possibly due to the pandemic. So she's thanking you both for all that you do, but that's of course disheartening news. I guess that would go along with consumption of alcohol, which we know is also increased during the pandemic. Christine Noble wanted to thank Kushbu as well. Very good information. She has family members who died from COPD from smoking. So really good work that everybody is doing.
To your point, Melinda, about the increased, I don't know if we've got to see an increased rate in smoking per se, but certainly in use of cigarettes or, additional people who might have been smoking before smoking more. And
Right.
like you say, it, I would say, is related to alcohol and other substance use. So, that we all know what those are attributed to, being able to work from home or, certainly stress. So we're just trying to put our, hold our hands against this dam and keep it, we've been making progress and we're hoping to continue to do that. And so combined with our work with our medical and mental health organizations in combination with the policy work that's done by Ellen Reinhardt and Lisa and Jessica from TFAC, they were responsible for those legislation to reduce access to flavored products and increasing the youth purchasing age. So those all combined with, smoke-free grounds and stuff is what we do to try to get the word out there and provide the resources to anybody who sees the value in making this one piece of the pyramid that we're trying to build for improved public health.
Well, thank you so much. Thank you both for coming today to share your work with the Healthy Ulster Council participants that are here today. I'm sure we'll have more questions going forward, and if we look forward to information that you have to share in the future. And thank you for all that you do. I'm going to bring us back to where we left off in the meeting in terms of where we're moving. So we're actually approaching our movement break. And typically, we would normally, if we were meeting in person, of course, have a healthy meeting break, do some stretching or some exercises, play a movement game, make sure that we're serving a healthy snack. I'd like to encourage everyone that is working today on Zoom and working so much in front of our computers these days to remember to have water beside you, keep hydrated, make sure you're eating low-fat snacks and keeping that to a minimum, and lots of fresh fruit and vegetables. But we also know that we need to move. And in particular, we get very stiff sitting in front of our computers, and it's not really great for a lot of our joints. So I'm got here today to share with you a couple of quick YouTube videos. One is for adults that are at work like we are. The other we'll share the link to. It's a lot of fun. I did a little research on it yesterday. If you have children or if you are working with youth, SpongeBob is, of course, a favorite of many, and there is a YouTube video of exercises going along to some of SpongeBob's movements. So we'll share that link as well. Just remember that kids that are also sitting in front of computers so much need to move as well. So I thought we'd share that too. I'm going to stop sharing my screen and I'll ask Katie to bring up the YouTube video. And this is, you don't have to get up. You can sit right here. It's great if you want to have your camera on. I'm going to keep mine on and move. This is literally going to be neck, shoulders, hands. So it's just a very quick couple of minutes. Whoops, that's the SpongeBob one. And here's the one that we're looking for.
The SpongeBob one is the one that's a link in the chat, but this is the grown up.
Okay. This is the other one. We'll share this link as well. It's really quick. It's just at 3 minutes and you can save this link. We'll share that in the chat and you can go ahead and play that, Katie. I think it starts, just kind of follow along.
Which exercises are best to do at your desk. So I'm going to run you through a simple routine to do throughout your working day.
And that's so easy. So I ask you, again, we'll put that link in the chat and you can certainly bookmark that. We'll show just a couple of seconds, maybe, Katie, of the SpongeBob. It's actually fun, just so you have an idea of what it is. So that way, if you do have kids or work with kids, I will say after watching 5 minutes of it, the music gets to be a little bit, whoa, repetitive, but kids like it. So that's the important part.
Wait, somehow.
Oh, you moved to a different spot. That's okay.
This is it.
Oh, here we go. A lot of fun. You'll get the gist in a second. SpongeBob is above, doing it in a cartoon. It starts out of a cartoon. And then we have someone leading the exercises.
Is that good? Everyone
Yeah,
heard
that's good.
that?
So it changes like every 5 seconds. They'll do 5 of one thing and then switch to something else. So very fun. And there are many different ones available if you go to that YouTube site. So it's not just that one tape. So that's out there as well. And yes, it is too cute, Lisa. Thank you. So we're now going to move on to the next part of our meeting. So I just wanted to remind everyone, we do have a Healthy Ulster Google group. Generally, I add you once you've signed up for a meeting and you'll receive information about being part of the group. You can use this group to share your flyers, to work collaboratively with other participants in the Google group. But the Healthy Ulster Google group is there as a resource for you. And if you do not think you are a part of it, please feel free to email me. My email is here and the invite will come from me to join the group. As far as I know, everybody in this meeting should be part of the group. But if you are not or you are new, I will look through today's registrations and make sure that everyone is part of the Google group. So that is something available to you, and feel free to share with each other beyond this meeting time when we some of the information about your programs and things that you're doing. So you can also, in the Google group membership settings, you can change your display name. I've got mine with my name on it. Otherwise, it shows up as your email. And you can link this to your Google account. You can change that email as well. And you can adjust your subscription, and at any time you can leave the group. That's all under membership settings. So I just want to make everyone aware of that. Any questions on that? And if you feel that you're not part of the group or not receiving any emails from Healthy Ulster Google group, then just email me and I'd be happy to connect you. We've arrived at our facilitated discussion. This is where we are able to do some networking, and as members of the various agencies and organizations that have joined us today, you get a chance to share a little bit about an upcoming program or event that you're working on. We do have some rules of engagement for that. I'll call upon you to share, unmute, share your name, your organization, briefly share about an upcoming event or program that you would like everyone to know about. Try to focus on the program rather than everything about your organization, because you do have a brief amount of time. We've got about 20 people here today to share. And remember that you can also share additional details like your website or program dates in the chat. So use that chat. And again, you can use the Healthy Ulster Google group also to share more. Oops, so I'm going to stop sharing and we're going to head right into our networking session. And I'm going to go around my screen and just kind of move along. As people turn their camera on and off, you will jump around and, just know that I will get to you. And at the end, I will be sure to ask, did I miss anybody? So I won't miss anyone. So I am just going to start with going straight to my right. And I will say, Katie, is there anything extra that you would like to share about your programs today?
Nothing more about Farm to School, but I do want to thank everyone who took the time to sit down with me and do the inventory for health. And also the other, Farm to School is only 3 days a week. I did not even mention that. So in other 2 days, currently I'm working on a project, a pilot to map the food system in the Hudson Valley. So if anyone wants to talk about it, like if you have feedback on what should be on the map, or if you're interested in, testing out an actual map once we have one up and running and providing some input on that, you can be in touch with me.
Great, thank you. And I noticed some of you are turning your cameras on. This is where we do want to see your faces. We're networking. So if you're able to share, and be present at the meeting, it makes it a lot more personal if we can see you. Stacy, you're next on my screen.
Hello. So we are in the throes of the Omicron wave of the pandemic now, and just working on addressing everybody's questions. The New York State Department of Health is working on releasing a COVID quarantine release letter and an isolation letter that hopefully will be posted on their website. So stay tuned for that, more to come. A lot of people who have been positive or exposed are looking for that for their job and work. So that has been a bone of contention for a lot of people needing those notes for school and work. So that is in process as our case investigators and contact tracers are, not able to keep up with the tremendous surge of new cases every day. We're working hard in Ulster County through mask distribution efforts and giving out COVID test kits. So please do keep up with our postings on our social media sites. Follow Ulster County government, follow the health department's social media so that you can keep abreast of those opportunities to get these COVID prevention and mitigation resources that we're able to give out. And that's about it for now. We're looking forward to completing our community health assessment with many of you, and we haven't gotten our meeting started yet, but hopefully we will start to focus on that and put together another awesome document with great data that reflects where we are in Ulster County as compared to the region and state, so we can have a focus for improving our health outcomes moving forward in 2022. All right,
Great.
thank you.
Thank you. Veronica.
I'm a community health worker at Ellenville Regional Hospital. So we are starting our pharmacy program up again this month. That's where we give out free produce, free fruits and vegetables. Our next one will be on January 27th here at the hospital. It starts at 4 o'clock, and people can just line up with their cars and get a bag. aside from pharmacy, we're just continuing our fitness classes. We do a walking group on Monday and Tuesday. We have a strength training class on Wednesday afternoons, and then Thursdays varies between Tai Chi and yoga classes. So if anyone is interested, I'll leave my email in the chat and you can reach out. I can send the flyers. We're going to be posting, hopefully on YouTube, start recording our strength training classes. So I'll share the link for that in the future when we do. But that's it basically for now.
Great. Thank you, Veronica. Michelle.
Hi, everyone. I was just putting my contact information in the box. I work with Chunny, which is a health home, and we oversee various care management agencies, and we cover multiple counties. But I was looking to make sure I came on to this meeting today because I really get mixed messages about Ulster. Like some departments I talk to are like, we have no services. And then I followed up and one of our agencies is literally in the schools. So I really, if anybody is in need of children's care management services, which call me if you want more details on that, but you know, we could literally partner with a program and partner with schools, and they have staff that are from Ulster County that are willing to partner up with children and families. So I'm being very vague, I know, I'm sorry, but I don't want to do a mini presentation. My contact information is in the chat box, and if anyone here has kids or families with Medicaid that need some navigation, healthcare needs, or mental health or behavioral or whatever, call me and I will share more information with you. But sorry for a very confusing presentation.
I think I got it. So, and your information is in the chat. So thank you
My
so much,
contact
Michelle.
information is in the chat. I'll add our website as well. But I really, I'm more than willing to help connect whatever agency, school, or program that feels they could benefit from care management with agencies. Like I said, I think Astor is already involved in some of the schools, and they're willing to expand if that's needed. I'm the go-between between the actual providers, you know, and whoever needs it.
Thank you very much. I'm going to offer Khushbu and both Khushbu and Susan an opportunity to add anything else that they didn't get a chance to during the presentation. Khushbu?
Thank you so much, Melinda, for giving us the opportunity to present. And once again, if any of the medical or behavioral health organizations who are looking for partnership for tobacco treatment, we are here for education and resources, and we can help you establish a policy on tobacco treatment. So please feel free to reach out to either me or Susan. And Susan, if you have anything to add here.
I'll just put both of our email addresses in the chat box, and this way anybody who needs to contact us will be able to do that. And we appreciate your time today. Thank you.
Thank you. Ninette.
Everyone, my name is Ninette. I'm with Cornell Cooperative Extension. I was just hired a couple months ago as the Healthy Schools Coordinator. So I will be going, the City of Kingston got a large grant, and CCE of Ulster County is partnered with them to implement some of the Healthy Schools guidelines. And I'll be going into the elementary schools and setting up a wellness committee, a health and wellness committee, and establishing a wellness policy. And I'm just getting the ball rolling with it. And I'm really excited to start.
Wonderful. Thank you so much. And Kristen Kessler, you are right next to Ninette on my screen. So this works out perfectly.
Perfect. Yeah, so my name is Kristen Kessler. I work for the City of Kingston. Been here, I don't even think it's a month and a half yet. I said a month a couple of days ago, and I'm kind of getting close to a month and a half. I'm the new project manager for the Creating Healthy Schools and Communities grant that Ninette just mentioned. And so this program is a 5-year program that the city just received this grant, where we will be essentially working towards policy systems and environmental changes to help make the healthy choice the easy choice in the community in Kingston. And so I'm kind of overseeing all of it. I'm not doing the schoolwork. Ninette is doing fantastic. I'm learning a lot about it. Family Woodstock's actually doing the early care and education portion of the grant as well. And then I myself will be working on our food service guidelines, so going into community and work sites and helping to create food service or like nutrition guidelines, policies, and kind of working through the implementation on that part, as well as some behavioral strategies. And then we do have a portion of it that is also, it's called Connecting Routes to Destinations. So it's essentially active transportation. And I wanted to share that because as a part of that, there is the Kingston Pedestrian Bicyclist Master Plan. Emily Flynn is really spearheading that here. And there is a public meeting on Tuesday, January 18th. A lot of you have probably already received this email. I think if you're in this meeting, you probably did. But just kind of wanted to give a plug for anybody who lives in Kingston, who works in Kingston, who visits Kingston a lot, to attend this meeting and be able to give their input on the future pedestrian bicycle master plan. There's information on engagekingston.com if you'd like a little bit more info on what that is and kind of on the plan in general. And then lastly, if you do know of a community or work site in the city of Kingston that has a food service venue, whether it's something as large as a cafeteria or something as small as a vending machine, and they're interested in working to implement some food service guidelines, please let me know. I'll put my contact information in the chat box. For example, right now I'm working with People's Place, the YMCA of Kingston and Ulster County, and we're working with the Andy Murphy Center, the Midtown Neighborhood Center, on these food service guidelines. And fingers crossed, we'll be doing something with Health Alliance, but I know the hospital system is very busy right now, but just to give an example of sites that we'll be in.
Thank you. Much appreciated. And just so that the rest of you know, this was an example of where I use the Healthy Ulster Google group to share the information on the bike ped master plan, input sessions, and how you can do that also online virtually. So you should have all received that. I'm going to move on to Ruth. I think if you can unmute.
Fine.
There you go.
Can you now?
I can.
Okay. Okay. I'm Ruth Stratton. I'm from Fidelis Healthcare. We offer quality, affordable health coverage for children and adults. And it's open enrollment. And if you know anyone in need of health insurance, please reach out to me. I'd be happy to help. I put my information in the chat room. And I must say, I'm very happy today with what I've learned and what I'm planning to take to all our representatives so that they could forward the information to our clients.
Great, thank you very much. Jessica.
Hi, I'm Jessica. I'm the reality check coordinator for TFAC, Tobacco Free Action Communities. And I know Lisa's mentioned that her chat isn't working today, but Lisa also we work together. She's our community engagement coordinator. And then Ellen was on the call and she's our director, but she had to hop off. We don't have too much going on, but like Sue mentioned earlier, we do work on policy work around tobacco and vaping. So we help make the places we work, live, and play tobacco free. So if you know of any place that's not tobacco free or doesn't have a policy around it, give us a call, reach out to us, and we can work on that. And then on the youth end of things, our reality check program is a statewide program. And right now we have a video contest going on related to smoking in movies. So if you work with any youth, know any youth, it could be any youth in New York State. They don't have to be a part of a reality check program. They just have to be a youth, like 13 to 18. So not too young, but I'll put our website link in the chat so you can just click on it. But the deadline for submission is March 9th. So they do have, around 2 months to work on it if they're interested. And if you want to know more about that, feel free to reach out to me anytime. I'd be happy to share it with you.
Great, thank you. And Lisa, Jessica, you shared Lisa's chat doesn't work, but does Lisa want to share anything about your programs?
No, I covered it for both of us.
Okay, we're good there.
Yep.
Cindy.
Did you mean Cicely?
Actually, I said Cindy, but I'm not sure she heard me.
Oh, okay, I didn't see.
Cindy Noble? Cicely, you're on. You've got your screen
Sorry,
go.
I didn't see her whole
we'll
name,
give you
so
a
I
minute.
thought, oh, maybe. Sorry about that. I'm Cicely Wilson. I'm from Bard College Center for Civic Engagement. I had to join late today because we are in the midst of planning our Martin Luther King Days of Engagement this weekend. Usually we send our students out. We have first year students here during January participating in a citizen science program. And we send our students out to different community partners to volunteer. Unfortunately, this year we had to scale back and not do in-person off-campus events. So we are doing only on-campus engagement opportunities, which doesn't allow for a lot of off-campus partners to participate. But we are looking forward to a spring semester where we can move off campus and send our students out again in full force. And they are very excited to do that as well. So if you are interested in having students participate in your programs, volunteer, do research. There's all sorts of interests in students here. So if you have any opportunities, we would love to hear about them. I will be sending out, I believe at the end of January, a survey to community partners to hear what their needs are, because we are trying to arrange for an alternative spring break for our students to participate in. They could stay here over spring break. They're allowed to anyway, but also participate in some volunteerism in the community and get some experience and maybe make some connections that might lead to further experience or a job. So if you have any interest in that, please look out for that survey from me. Thank you.
Thank you. Thank you so much. And feel free to share more information either through the Healthy Ulster Google group or send it to me and I can share it on your behalf when you have that information. And Cindy Noble.
I think you meant me, Christine.
I've done it again. Do you know I have a Cindy Noble in my past, and that's why I'm always calling you Cindy and not Christine. So it's just like a Freudian thing where I slip back to being a teenager in school, and I'm with a friend that's named Cindy Noble. So my friend Christine Noble, can you please share?
I'll tell you the age now when they say don't call me late for dinner.
So sorry, Christine.
The seniors 60 and older, and we have now opened our congregate sites up now. It'll be 2 days a week starting February at the senior hub next to our office. So some of the seniors are starting to come back for the lunch program. We've had some Tai Chi going on for arthritis and falls prevention, which all this is on our website when it is and all that. I don't need to give you all the times and days, but same thing with the mall walk up at the Ulster County, the Hudson Valley Mall every Tuesday. They can look that all up too. There's some seniors that are meeting there and they're walking inside the mall, spaced apart, masks on, very healthy. And then we also have a game day going on at the senior hub that goes on every Wednesday from 1 to 3. They're playing dominoes, all separate tables in spaced areas and that type of thing. So warm calls, call our office if you know any seniors that could use a warm call, somebody to just be like a friend to call them up every once in a while and see how they're doing. And we've got quite a few of those going on too. So all that's available, just calling our main number, and everything is on our website. So if you need to look anything up, our lunch and learns are off for now. And winter months, everybody's trying to be careful with a lot of that. And even the movies, we were doing movies in Rosendale, but we stopped that for a while. So there's quite a few things you can just look on our website. And thank you for the 2 people that did the presentation today. They were really well, very informative. Thank you.
Thank you, Christine. And I just want to introduce also Kate. Kate, I don't know if you want to put your screen on for a second. Kate works for Cornell Cooperative Extension, saying hi. And Kate does all of the meeting notes, which you can find posted. I'll share the website for that at the end of our presentation, but just give you an opportunity to say hello. And I think everybody here has had an opportunity to share. Did I miss anyone?
I have a quick question. Oops. I have a quick question.
Yeah.
You'll save me a ton of time. Who replaced the SPOA coordinator? Does anybody know the children's SPOA coordinator who retired?
Yes, Katrina Williams. She's a mental health specialist here at the Ulster County Department of Mental Health.
Thank you. I sent an email and it got bounced back, and whatever phone number was attached was wrong. Katrina, what's her last name?
I'll email you her contact information.
Thank you, guys. Sorry to.
No,
I figured
that's
I'd grab
fine.
Ulster people.
No, we're here to help each other. It's part of the reason that we do spend some time networking and sharing our programs. It's, to help each other, with your own deliverables and to clearly serve the people of Ulster County. So if we can help in any way with information, of course, that's one of the purposes of our networking session. We're about to move into just the final portions of the meeting. And I can just get my screen to share here. I just wanted to share with you, we're going to be going into a Jamboard again. If you've been at previous meetings, we've been doing this where we share some Post-it notes. I'm going to ask Katie to put the link in the chat and then we'll just share from there. But you basically how it works is once it opens up, you click on the link that's in the chat and we'll all end up at a shared space. And you take your cursor and go over and click on this handy dandy Post-it note here. You use that toolbar and grab it and you can type the answer into it. And all you're going to share today is something I learned new today. This is part of our meeting evaluation. And we'll have 2 of these. Also, we'll be talking about what you'd like to learn about in the future with our professional development. So I'm going to stop sharing and let's see where we're at here. In the chat. So the first Jamboard is the one on top. And if you click on that, we should all be in the same meeting space. And something that you learned today that's new in the Meet Healthy Ulster meeting, and you just kind of click on your Post-it note. It's a sticky note. You can pick a color and type what you learned. You should be able to do that pretty quickly. And I'm just thinking myself, I learned so many things at the meeting today. Without a doubt, I learned there's one thing that I learned. And is everybody able to see the Post-it note screen? I see somebody are putting some things up. Reese is a farm to school. I learned about the New York State Smokers Quit line. Never even thought of all that went on in school food selections. I shared there are more types of cancer than I knew that were connected to smoking. I always think of lung cancer and mouth cancers, but I didn't realize so many cancers were connected to smoking. Okay, and then we've got a few others. So I learned about the New York State 30% initiative. I learned that there is a standardized way for healthcare practitioners to address smoking behaviors. I learned more about how schools were selected for farm to school. I knew school food procurement was complex, but I didn't realize all of the avenues on how schools received food supplies. And then of course, tertiary hand smoke dangers. I learned more about e-cigarettes and vaping. And farm to schools focus on local selections can include any products such as pasta or other local products. Yeah, we don't really think about that, right? Like bread and wheat also being part of that. Okay. You can continue to add to this, and you can use this link to return to this if you so choose. I want to take a look at the next link. So go back to the chat. The second link is another Jamboard, and these are saved and available. We can make these links available so that you can see them. In this particular one, you're going to put up Post-its or sticky notes on what topics or social determinants of health that you would like to learn more about in 2022 as we set up our speaker schedule. So things you want to learn more about this year. So we have 1, 2 up there. We've got pandemic and mental health. We have the work the city is doing to increase bike pedestrian access. Things you would like to learn more about. Okay, we have different approaches to mental health in youth. We also have, let's see. We have any environmental justice initiatives going on in the county. We have climate change impact on health and the connection to social disparities, different approaches to youth programming in Ulster County, relating food and nutrition and environmental health, and different approaches to mental health in youth. So a couple of youth programming initiatives, some bike pedestrian access, environmental justice initiatives, climate change and social disparities, intersection of cannabis with the connection to mental health, the pandemic and mental health, affordable housing in Ulster County, and relating food and nutrition and environmental health. So we have quite a few topics to kind of focus on and take a look at as we plan out our year. If you have more that you would like to share, again, the link is active. You can continue to put things up there. And thank you so much for participating in that. That's really helpful for me going forward in our planning. And we have reached, it's hard to believe, I'm just looking at the time, 3:30 on the nose, magic. But we are at the end of our meeting and our time together with all of you. And I can't thank you enough for coming to our January Healthy Ulster Council meeting. And thank you to our presenters for sharing such meaningful information on the programs that you are working on in both our county and in the region. And I wanted to also share that our upcoming meeting will be Thursday, March 10th, still on Zoom, 2 to 3:30 p.m. And you can visit healthyulstercounty.org for more information, and Cornell Cooperative Extension Healthy Ulster Council. You can type that in to get the link for meeting notes. And just again, thank you so much for being with us today. Stay safe. And it sounds like, just follow the information on Stacy. Maybe you just want to share one more time in chat, the Vaccinate Ulster webpage, the site, so that people can get more up-to-date information on testing and vaccines and COVID in Ulster County. We want everyone to stay as safe as possible. So thank you.